Okay, good. Thank you for coming this morning to the ribbon cutting for the DARE Community Care Clinic. We appreciate you all being here. On behalf of the Chamber, I'd like to thank Bill Gleason, wherever he just went to. Bill, come forward. Bill's the chairman of the board of the Community Care Clinic of DARE, and we're going to ask him to say a few words in a moment. Just want to thank some special people for being here. I have some members of the board of directors. I have Allie Barreau, who is our immediate past chair as of Tuesday night. Jeff Dowdy, our treasurer, is here. Malin White, who is our new chair-elect for this year. And Matt Byrne is here. Right over there. So thank you all for being here. We have a lot of elected officials here that I want to mention. I know I have Warren Judge here from the county, Chairman Judge. Appreciate you being here.
Thank you.
Do you want to say a few words?
Right now.
Never give a politician a microphone.
That's a different way. I'm sure you want to introduce my friend the mayor before you get me.
Well, I'm going to introduce them all. We also have with us, let's see, I have Mayor Bob Oakes with the town of Nags Head, as well as Susie Waters with the town of Nags Head. And Cliff Auburn is here as well, town manager. We have Hal Denny, the mayor of Southern Shores. Thank you, Hal, for being here. And Bill Pitt with the town of Kill Devil Hills. I think I got everybody. If I didn't, raise your hand.
Mayor Pro Tem Doug Romali.
What do you say?
Mayor Pro Tem Doug Romali.
Ah,
Next.
Deborah Malley.
Doug.
Doug. Mayor Pro Tem, thank you for being here. Yay! Now, Warren, do you want to say a few words? You probably don't need the mic.
How much time? Thank you, Madam President. Great. It's good. It's good to see everybody out here. Thank you for coming. And I took care of the weather today, or at least at this point of the day. I'm excited about this. Community Care Clinic was a good organization. And the county was at a time where the county could do some serious funding, and we did for the first couple of years. And then times began to get a little bit tighter, and we had to cut back a little bit. But they've done such a great job in what they serve, and we have such a need in the community of people that are very thankful for that. And when we first funded or made our contribution, we talked about the responsibility of trying to make sure that the working sick people get cared for and don't carry that sickness to the workplace, because it's the very people that we serve that can't afford to miss a day's work. And I'm proud of you. I'm repeating myself, but I'm so proud of this facility now. It's a great home. Thank you, Mayor Oakes. Thank you to the town of Nags Head. Doug's here. Susie, thank you. Mental health around the corner. But thank you so much for making this facility available to this very worthy need. And for all of y'all out there that raise money and give money, thank you, and just keep it coming. Have a good day.
Well, Karen's already introduced a lot of the people I was going to introduce, but that's fine. This place, those of you that have not lived on the Outer Banks a long time, was built, I believe, back in the 80s. It was the original clinic on the beach before the hospital was constructed. It served as a clinic, and then it sat vacant, I think, for 6 or 7 years. And as I understand from Nags Head, there was even consideration of even demolishing it. But then along came the Coastal Studies Institute, and they actually leased this facility for 10 years. And they, of course, last January moved to their new facility. And Rick Gray and myself and several of the board members approached Cliff Ogburn, town manager of Nags Head, and also met with Bob Oakes. And graciously, the town of Nags Head agreed to lease this facility to the Community Care Clinic of DARE. We were just down the street, but for a number of reasons, we needed to move, mostly financial, And the town has been very gracious in letting us lease this facility at a very affordable rate for us. In fact, last week they just renewed our lease for another 3 years, so we're extremely pleased with that. That's one reason we're here. The commissioners of Nags Head, Bob Oakes and the other commissioners, and Cliff Ogburn. There are other groups that have made this possible today. There's a sign over here on the right that we actually ran an ad in the Coastland Times and the Sentinel. We think we have a comprehensive list of everybody that helped with the renovation, contributed time, materials, effort. There's one group that stands out above all the rest, and I can't read all the names, but we'd like for you to read those names. But there's one group that did the lion's share of the work and probably saved us 3 months of time. And that is the men of the Duck United Methodist Church. They're called the Caring Hands. Shelby Hines. Shelby, if you would raise your hand, he's the leader of that. And seriously, we had the mayor, Hal Denny here. We had the police chief, David Cole, working. We had other individual cotton wells, I think, and there were probably 10 of them working here a lot. Not only did they do all the work, I got your name wrong, excuse me. They did all the work, they bought all the materials, they did everything, and it's just amazing when you go in. You won't really believe what it looked like before, and that's why there are some photographs here of what this looked like when under renovation. We started renovating in March, and we moved in July 3rd. And like I said, it wouldn't have happened had it not been for the Caring Hands group, and we sincerely appreciate all of your efforts. Can't thank you enough. I'd like to all 1,000 adults in Dare County who have no health insurance. And about half of those adults are at 100% or less of the federal poverty level. Those of you who maybe are acquainted with it now since you've been listening to all the Affordable Care Act stuff on the news, but for a single person, adult, the 100% of federal poverty would be an income for a year of $11,490. That's a hard income to live on. For a family of four, 100% of federal poverty is about $23,500. About half of our patients are at or below 100% of the federal poverty level. These are unfortunately the group, because the state of North Carolina did not elect to expand Medicaid, that they had that option. Those people will not be eligible for Medicaid. In fact, they will not be eligible for any subsidies under the Affordable Care Act, which was not the original plan, but the state elected not to proceed with Medicaid expansion, at least at this time. That makes our job even more important. We take care of those people, and some above that 100% level, so we're very pleased to serve them. I think our mission really is to put ourselves out of business. Ultimately, we would like for everybody to have health insurance and coverage. We hope that we morph into something different, but we love what we're doing, and we have a great staff, a great board, great volunteers, and we appreciate all of you coming here today. So, watch out.